Hey guys, and welcome back to Confessions of a Doctorholic. If you're new here, my name is Hafsa and I'm a general surgery resident in the US. And this podcast is where I share real stories from within the walls of the hospital, behind the scenes. Today's story is one of those cases that started off kind of subtle. Nothing dramatic at first, but slowly turned into something much more serious. And it's a reminder that sometimes in medicine, the most dangerous things are the ones that don't look that bad in the beginning. So this was a patient who came in as a level 1 trauma. She had been through a lot. The story was that she was drinking and driving, her sister was the passenger, and they were driving like crazy fast on the highway, smashed into a pole. Her sister died at the scene and she was very, very unwell. She had heaps of injuries. We're talking liver and spleen lax, fractures, broke her arms, broke her legs, and it was freezing cold outside. So she was hypothermic as well. She was intubated. So naturally, all of our attention was on the big injuries, the life-threatening stuff. I'm pretty sure she had a brain bleed as well. And this is typical for what you do in trauma. You focus on what's going to kill the patient and keep them alive. But during sign out, one thing was mentioned almost casually. Her right hand looked off. Nothing specific, just something didn't look right, and at the time it wasn't the priority because, again, she had much bigger problems. But over the next day or so, the hand started to change. Blistering, it went from pale to like more bluish. And I remember looking at it and thinking, this looks familiar. I've seen this before. When I was on my vascular rotation, there had been a patient we were consulted on. They had bilateral blisters and that bluish-like appearance. And I remember looking it up and thinking, is this frostbite? And they still had pulses, which is why it got pretty confusing. So in this case, I brought it up again because the appearance was becoming more and more obvious. And since it was a hand, plastics got involved. They did all the right things. They got imaging. They got a CTA, which was looking at blood flow, and it was normal. Then they did an angiogram, and that was normal as well. And now we're in this weird situation because clinically and objectively, it looks pretty bad. But the imaging tells us that the larger blood vessels are still open. And this is where things get interesting because frostbite doesn't show up, at least not initially, as a large artery dysfunction or a blocked artery. That would literally just show up as no pulses on exam. The damage that's done is usually at a microvessel, like really tiny vessel level, and the tissues themselves. So even if the big vessels look okay, it doesn't mean that the tissues are not dying. At this point, there's not much you can do immediately, and this was one of the hardest parts. It was waiting. We had to wait for something called demarcation, which basically means we're waiting for the body to declare how much of that hand or the tissue around it is dead and what's still alive. And what that looks like is literally a line. It's like you're drawing a line with a pen, except instead of a pen, there's clearly like a darker color for the tissue that's dead and a lighter one or like the basic color for the tissue that's not dead, and that takes time. While all this is happening, the patient's getting sicker because don't forget, this is a trauma patient. She had heaps of injuries. She's fighting the SIRS response that her body is dealing with, and on top of all of this, her hand is deteriorating. Eventually, it became pretty clear it wasn't reversible. The damage was too severe. And there are some therapies that people can do, namely TPA, that's FDA approved within the first 24 hours, but we've gone way past that window. It was advanced frostbite, and at that point, there was only one option left, amputation. The only thing that would make us amputate before the actual demarcation was if she had like fevers, chills, stuff like that. And I think what really stayed with me about this case was how it started. Something really small, easy to overlook. Multiple teams have seen this patient and overlooked it. when it actually evolved into something really life-changing for this patient. Losing a hand, and losing any limb really, but like losing a hand significantly changes your function. It changes how you do things. Like you literally can't even eat using your right hand. Like you would have to rely on using your left hand. If she's right-handed, which per the rest of her family she would now have to learn to write using her left hand. So it's not a small thing. This is life-changing. This case taught me something really important. In medicine, you really have to pay attention to the tiny details because sometimes they're early signs of something that's heaps larger than you can ever imagine. And also, some things cannot be fixed immediately. Sometimes you do have to watch carefully and wait for the exact right moment to act. So, confession. Some of the hardest decisions in medicine aren't about what to do. They're about knowing when there's nothing left to save. So I want to ask you guys something now. Have you ever ignored something small that later turned into a huge problem? Let me know, and I'll catch you next time. Have a good one.